Apple cider vinegar might be the most hyped health product on the internet. It's been sold as a cure for almost everything: weight loss, blood sugar, digestion, detox, glowing skin. Some people treat it like a miracle in a bottle. Others dismiss it entirely as wellness nonsense. So who's right? The truth, as usual, sits somewhere in the middle, and it's far more interesting than either extreme, because when you actually look at the scientific research, apple cider vinegar does have real, measurable effects on the body, but they're not the effects most people think, and they're not nearly as dramatic as the marketing claims. Today, I'm going to show you exactly what the science says, what apple cider vinegar genuinely does, what it doesn't do, the side effects nobody warns you about, and precisely how to use it if you decide to. I'm James Mercer, and welcome to the Longevity Tip. In this video, we're going to separate evidence from hype. You'll learn the benefits that are genuinely well documented in human studies, the ones that are promising but still unproven, the real side effects and who needs to be careful, and the correct way to actually use apple cider vinegar to get the benefits while avoiding the risks. Let's get into it. Before we talk about what it does, it's worth understanding what apple cider vinegar actually is, because that explains where its effects come from. Vinegar is produced through fermentation of the sugars present in various foods. Apple cider vinegar, specifically, is made by fermenting the sugars found in apples. But here's the interesting part. If you stopped at the first stage of fermentation, you wouldn't have vinegar at all. You'd have something closer to wine. What makes vinegar distinct is a second stage. Acetic acid bacteria convert the alcohol into acetic acid. That acetic acid is the primary active compound in vinegar, but it's not the only one. Apple cider vinegar also contains other beneficial organic acids: malic acid, tartaric acid, and citric acid. And it contains phenolic compounds, natural antioxidants that neutralize free radicals in the body. Apple cider vinegar specifically contains chlorogenic acid, coumaric acid, and protocatechuic acid. These two groups of compounds, the organic acids and the polyphenols, are largely responsible for the health effects that have actually been demonstrated in research. So when we talk about the benefits of apple cider vinegar, we're really talking about the effects of acetic acid and a group of antioxidant compounds. This matters because it tells us the benefits are real biochemistry, not magic, and it sets realistic expectations for what these compounds can and cannot do. Of all the claims made about apple cider vinegar, one stands above the rest in terms of scientific support, and it happens to connect directly to topics we've covered before on this channel. The single best documented effect of apple cider vinegar is its ability to lower blood sugar. Research published in 2019 and 2020 demonstrated that consuming vinegar reduces blood glucose levels. This is particularly significant for people with type 2 diabetes, insulin resistance, or prediabetes, conditions we've explored in depth in previous videos. In one study, drinking just 20 milliliters of apple cider vinegar per day lowered blood sugar by 10 milligrams per deciliter. That is a genuinely meaningful result from such a simple intervention, but it goes deeper than just lowering glucose. The current evidence shows that apple cider vinegar can increase the sensitivity of your tissues to insulin, meaning it can help reduce insulin resistance itself. In simple terms, your body doesn't have to release excessive amounts of insulin, which are themselves harmful over time, to bring blood sugar under control. In people using apple cider vinegar, researchers observed improvements in the standard markers of insulin resistance, measures called HOMA-IR and Quickie. And critically, apple cider vinegar produced a favorable reduction in glycated hemoglobin, HbA1c, which is the marker doctors use to assess long-term blood sugar control. A reduction here means better diabetes management over time. There's even preliminary evidence, so far only from animal studies, that apple cider vinegar may help protect the liver and kidneys from the damage caused by diabetes, suggesting a possible protective role against diabetic complications. But I want to be clear, this liver and kidney protection has not yet been confirmed in human studies, so we treat it as promising, not proven. If there is one reason to take apple cider vinegar seriously, this is it. The blood sugar benefit is real, it's measurable, and it's supported by human research. For anyone dealing with elevated blood sugar, insulin resistance, or prediabetes, apple cider vinegar is a low-cost, evidence-backed tool worth considering as a complement to, not a replacement for, proper medical care. The blood sugar benefit is the strongest, but it's not the only well-documented effect. The next two matter enormously for long-term cardiovascular health, and one of them is the most misunderstood claim of all. People with lipid disorders, specifically high triglyceride levels, may also benefit from apple cider vinegar. In one study, consuming 30 milliliters of vinegar per day reduced blood triglyceride levels by 40 milligrams per deciliter. That's a substantial effect. And the benefit held even at lower doses. People consuming just 15 milliliters per day saw triglycerides drop by 20 milligrams per deciliter. Here's why this matters so much. Researchers calculated that reducing triglycerides by that 40 milligrams through vinegar consumption corresponds to reducing the risk of coronary heart disease by approximately 10%. A simple dietary addition producing a measurable reduction in heart disease risk is not something to dismiss. Now to the most hyped claim of all, weight loss. Apple cider vinegar is marketed relentlessly as a miracle weight loss solution, and I want to be completely honest with you here because this is where the marketing and the science diverge sharply. The truth is a half-truth. Yes, research does show that consuming apple cider vinegar can assist with weight loss, but let's look at the actual numbers. A study published in 2018 found that consuming 30 milliliters of apple cider vinegar per day resulted in a reduction in body weight of just over 1.5 kilograms compared to a control group, and that reduction happened over a period of 3 months. So, using vinegar for 3 months, participants lost an additional 1.5 kilograms. There was also a reduction in hip circumference of 2.5 centimeters. So does vinegar support weight loss? Yes, but is it a miracle? Absolutely not. The effect is modest, real but modest. Anyone promising dramatic weight loss from apple cider vinegar is overselling it. Think of it as a small helper, not a solution. This is the honest picture. Apple cider vinegar genuinely improves triglycerides with a real calculable benefit to heart health, and it genuinely supports weight loss, but modestly. Understanding the real magnitude of these effects protects you from both the hype and the dismissal. The benefits are real, they're just not magic. Before we continue, if you're finding this useful, take a second to subscribe to the Longevity Tip and hit the notification bell so you don't miss the next video. And if you know someone who's curious about apple cider vinegar or who's fallen for the hype, share this with them. It costs nothing, and honest information is worth passing on. Now let's continue, because there are several more benefits worth knowing and some important warnings. Beyond blood sugar, cholesterol, and weight, apple cider vinegar has several other documented effects, including one that's particularly relevant for women's health. Apple cider vinegar has well-documented antimicrobial properties. Researchers have shown that it can inhibit the growth of disease-causing bacteria, including Escherichia coli or E. coli and Staphylococcus aureus, commonly known as golden staph. It also prevents the growth of the fungus Candida albicans, the organism responsible for Candida infections. This antimicrobial activity is one of the oldest known uses of vinegar, and modern research supports it. Pilot studies conducted on a small group of people suggest that vinegar may relieve constipation. Interestingly, this was studied specifically in patients being treated with a medication called clozapine, one side effect of which is slowed intestinal movement, leading to constipation. In some cases, that constipation can lead to serious digestive complications. Based on these studies, it's reasonable to conclude that vinegar consumption may help with this problem, though the research base here is still small. Current evidence suggests apple cider vinegar can be a valuable dietary addition for women with polycystic ovary syndrome, PCOS. Researchers found that consuming 15 milliliters of apple cider vinegar per day restored ovulatory function in women with PCOS. They suggested that, because of this effect, vinegar may help address fertility difficulties in these patients. The researchers also observed that apple cider vinegar reduced insulin resistance in the women studied, and insulin resistance is one of the most common metabolic disturbances in women with PCOS. So apple cider vinegar may improve health on multiple fronts for women dealing with this condition. These benefits round out the picture: antimicrobial action, potential relief of certain types of constipation, and meaningful support for women with PCOS. Not miracle cures, but real, research-supported effects that make apple cider vinegar more than just a wellness fad. Now for the part most wellness content conveniently skips: the claims that aren't proven yet and the side effects that are real. There are several benefits that appear promising but have only been demonstrated in animal studies, which means we should treat them with caution until human research confirms them. Animal experiments suggest apple cider vinegar may have hepatoprotective effects, protecting liver cells. In animals, it protected liver cells from damage caused by mercury and reduced liver damage caused by acetaminophen, the painkiller known as paracetamol. In those studies, antioxidant levels in the liver were restored, inflammatory markers dropped, and liver enzymes improved. This is genuinely encouraging, but it comes from animal data and needs confirmation in humans. Similarly, there's research suggesting vinegar increases calcium absorption in the intestines by making calcium compounds more soluble and available. But again, animal studies only. Approach these claims with appropriate caution. Now the warnings, because vinegar is an acid, and acids can cause harm. First, and most important, apple cider vinegar, consumed in excess and especially undiluted, can damage tooth enamel and can irritate the tissue lining your mouth and throat, leading to serious irritation. This is the single most common way people harm themselves with apple cider vinegar. The solution is simple: always dilute it in water or use it as a base for salad dressings. Never drink it straight. Second, there is a documented case in the scientific literature of hypokalemia, dangerously low blood potassium, resulting from drinking very large amounts of apple cider vinegar, around 250 milliliters per day. Now, I share this mainly as a caution because almost nobody drinks that much, and you certainly don't need to get the benefits. But excess vinegar may disrupt your body's acid-base balance, contributing not just to potassium loss, but potentially to bone health problems and an increased risk of osteoporosis. Because of this, people taking diuretic medications, which also cause potassium loss, should be especially careful. Third, and this connects to the blood sugar benefit, because vinegar lowers blood sugar, combining it with diabetes medications could in theory cause blood sugar to drop too low, a dangerous condition. If you take blood sugar lowering medication and want to use vinegar, monitor your blood sugar carefully and speak with your doctor first. Finally, the effect on acid reflux and heartburn remains unclear. Some people report that vinegar relieves reflux, known as GERD, but the convincing evidence to confirm this is lacking. In practice, diluted vinegar seems to help some people with mild reflux, while others should avoid it. This is what honest health information looks like. Apple cider vinegar has real benefits and real risks. The promising animal study claims might turn out to be true, but aren't confirmed yet. And the side effects, while manageable, are worth respecting. Knowing all of this puts you in control, able to capture the benefits while avoiding the pitfalls. So if you've decided apple cider vinegar is worth trying, here is exactly how to use it to maximize the benefits and minimize every risk we just discussed. First, and most important, always dilute it. Mix 1 to 2 tablespoons of apple cider vinegar into a full glass of water. Never drink it undiluted. Your total daily amount should not exceed 2 to 3 tablespoons. More than that doesn't give you more benefit. It just increases the risk of side effects. Timing depends on your goal. If your aim is weight loss, drink it before a meal, particularly a meal rich in carbohydrates, since that's when the blood sugar effect is most useful. In other situations, it's best to consume vinegar together with a meal. After drinking it, rinse your mouth thoroughly with water. This simple step protects your teeth from enamel erosion and cavities, addressing the most common side effect directly. And when choosing a product, look for apple cider vinegar that is unfiltered, unpasteurized, made from whole apples, and sold in glass bottles. This is the form that retains the most of the beneficial compounds we discussed at the start. That's the complete protocol, diluted in moderation, time to your goal, with your mouth rinsed afterward using a high-quality product. Follow these simple rules and you get the genuine research-backed benefits of apple cider vinegar while sidestepping every major risk. So here's the honest bottom line on apple cider vinegar. It's not a miracle, but it's not nothing either. The science shows real, measurable benefits: lower blood sugar, improved insulin sensitivity, reduced triglycerides, modest weight loss, antimicrobial effects, and meaningful support for women with PCOS. Some additional benefits are promising, but still unproven, and there are real side effects worth respecting. Used correctly, diluted in moderation with the right timing, apple cider vinegar is a genuinely useful, low-cost addition to a healthy lifestyle. Just don't expect it to do the work that diet, exercise, and sleep are supposed to do. If you found this useful, leave a like and subscribe to the Longevity Tip. It helps more people find this kind of content. I'm James Mercer. I'll see you in the next one.